Today we're going to go over crutch training. So whenever you have your patient and you have orders that they need to have some crutch training, you'll go ahead and grab either crutches or a walker. Most patients that are over about 40 or are not very nimble may require a walker. So in just a moment we'll go over walker training. What we'll do first is go over the crutch training. So you'll want to compare in the chart to see what their height is. Her height today is 5'2", so we grab some 5'2" crutches, and we're going to make sure that the arm grippers are in the right spot. So in order to assess that, you need to put the gait belt around the patient and have them get into a standing position. So we'll put this around. Again, you want to go around the mid-waist there, pretty snug around the waist, so that if they do start to tumble, you got a good grip on them. Okay. Then what you'll want to do is encourage the patient to get to the edge of the bed, or the edge of the chair, and then go ahead and stand into a standing position. These crutches are going to go into the upper armpit area. Good, and then you're going to want to tell the patient to go ahead and bring your crutch out and the tip out to about 6 inches out to the side at a 45-degree angle, and stand up as tall as you can. Good. You're going to want to take your 2 to 3 finger lengths and put them in the upper armpit area. These are actually just a little bit too short for her, so we're going to go ahead and bring them up. We'll take one of these crutches and pop it up to the 5'3" area. Good. And again, checking for good placement. Now we're in a good spot here. We got about 2 to 3 finger lengths in the upper armpit area. Then you're going to want to have her bring that arm down by her side. And it looks like we need to move one up. Okay, so we should go over that. Go ahead and let yourself take a seat there, and we'll get these crutches fitted for you. When it comes to increasing the size of the crutch, you're going to want to go ahead and grab that wing nut. Go ahead and screw it off here. And we'll pop that out, and we're going to move it up to that top spot. Now that we have the crutches fitted for the patient, we'll go ahead and have her stand up again and go over crutch training. Okay, whenever you're ready, go ahead and get in standing. The crutches go under each armpit area there. Okay, first what we'll go over is non-weight bearing, okay? So that means with your affected injured leg, which is going to be your right side, you don't want to put any pressure down through that leg, okay? So crutches come forward and then swing through with that left leg, good? And then crutches forward, making sure that you have enough space to fit through those crutches. Okay, next what we'll do is go ahead and go over weight bearing is tolerated. So that's when the doctor's going to allow the patient to put a little more weight down through the leg here. So we'll go ahead and get her into a standing position, good? And again, the injured leg is the right leg here. So she is allowed to put a little pressure down through that right side. So you're going to bring those crutches forward, right leg forward, a little bit of pressure, stepping through, good. And left leg, crutches forward, right leg, and left, good. Now what we'll do is go over walker training. So any of those patients, like I said before, that are maybe 40 years and older, maybe aren't as nimble of a patient, you may want to go ahead and grab that walker instead of those crutches. If the patient is refusing to use the walker and you feel as though that patient would really benefit using a walker, it's not a bad idea to just bring both in, have them try it. Most of the time they go with the walker because it is a lot more stable. So what you'll want to do, we're going to go ahead and assess to make sure that the walker fits the patient. We're going to encourage her to get to the edge of the chair there, and then pressing up with the arms to go into a standing position. Now we're going to check for the height on this walker. If you'll see here, the walker is a little too high for her. Way to check that is to have the patient bring their arms down by the side. We want this gripper here to be in alignment with the bend in her wrist here. So we're going to go ahead and lower this walker down. Okay. You can lower the walker down by pushing in the point here and lowering it all the way down to its lowest part. So again, you're just looking for that bend in the wrist, making sure that it's in alignment with the gripper on the walker. So she'll get into a standing position, arms down here, and you can see it's in the right spot here. Okay, so first what we'll do is go over non-weight bearing with the walker. You're going to encourage the patient to push that walker forward. Her injured right leg will be up in the air there, and she's going to press with her arms as she steps through on the left leg. Walker will come forward and stepping through on the left. Good. Walker forward and left. Walker and left. Good. Now what we'll do is go ahead and go over weight bearing is tolerated, we'll encourage her to get into a standing position. Good. She can put a little pressure down through that right side. So the walker will come forward. You're going to take that right leg, bring it forward a little bit, little pressure using the arms to de-weight, and step forward with the left. Good. Right and then left. Good. Right, little pressure down through, mainly through the arms. Good. Now what we'll do is go over some stair training. So if you have any patients that need to go up a large flight of stairs right after surgery, go ahead and encourage them to go up on their bottom. If they have to go up to that upstairs bedroom or upstairs apartment, but right when they get home, you may want to encourage them to put a chair at the top of that top step so that they can go all the way up the stairs on their bottom. And then once they get up to that top step, they can scoot up onto that chair, and then they can get into a standing position a little bit easier than all the way down on the floor. If the patient does not have to get up onto those stairs right when they get home, go ahead and encourage them to stay downstairs if they can for that first 24 hours to 48 hours till their head gets a little more clearer after the anesthesia. Now, if the patient does need to go up just a few stairs to get into the house, this is the way that you'll want to teach them how to get into and out of their house with a few stairs. So what you'll do is first we're going to go over non-weight bearing. So what you'll do is have that patient go ahead and walk a little bit close to that curb or to the steps. And then when you have a patient that is non-weight bearing, remember that the crutches are an extension of their bad leg. So you'll want to have them go up with their good leg and down with their bad leg. For this instance, her good leg here is her left leg. So she's going to want to hop up onto that step, whether it be a curb or a step. You'll want to hop up onto that step here. Good. And then the crutches and the bad leg come up onto the step there. We'll do it again for you. Up, and then crutches and everything come back up. We'll go ahead and turn around here. Good. Now, when it comes to coming down the step, it's a little more scary, but with it just being a few steps, it's not too difficult. You'll bring those crutches down to the next step here, and then she's going to go ahead and hop down to that next step. Good. Crutches come down and hopping down. Perfect. All right, next what we'll do is go ahead and go over weight bearing is tolerated with those crutches. So this is going to allow the patient to put a little pressure down through the leg. Again, if that patient does have to go up those stairs that first night, try to encourage them to stay downstairs or go up onto their bottom just because they're a little unsteady from the anesthesia and all the drugs that they were given that same day. After that though, in order to go up onto the steps or up onto a curb, remember that up with the good and down with the bad. This is her injured right leg, so she's going to come close to the step there or come close to the curb. She's going to go ahead and hop up onto that step with that good left leg. Good. Then she's going to bring her crutches and her right leg up onto the step there. We'll do it again here, hopping up onto the step. Good. And then she can go ahead and turn around here and we'll go down the step. All right, so then now it's time to come down. Remember, the crutches are an extension of that bad leg. So the crutches and that bad leg or the right leg will come down, putting pressure through the arms and then matching with the good leg. Good. That way it'll allow her good leg to descend down onto the step.